Doctor, all my tests are normal, then why am I still suffering? Hi, I am Dr. Prasanth Nagarajan, colorectal surgeon, and today we are going to talk about something that affects millions of people silently every single day. Irritable Bowel Syndrome or IBS. If you are someone who feels bloated after eating, rushes to the toilet before meetings, alternates between constipation and diarrhea, or constantly worries that something is wrong despite normal reports, then keep watching this video till the end. Many people suffer for years without understanding what IBS really is and keep changing doctors and keep changing the treatment. Some feel embarrassed to talk about it, some think it is just gas, others fear it might be cancer. Today, let's simplify IBS in a very practical and relatable way. By the end of this video, you will understand what exactly IBS is, what are the common symptoms, how doctors diagnose it, the different types of IBS, red flag symptoms that you should not ignore, and most importantly, how you can control it and improve your quality of life. IBS stands for Irritable Bowel Syndrome. It is a very common condition where the intestine becomes extra sensitive and starts behaving irregularly. Now here is the most important part. IBS is a functional disorder. That means when we do scans, blood tests, endoscopy or colonoscopy, many times everything appears normal. There is no ulcer, there is no tumor, no visible damage, but the symptoms are very real. This is why many patients become frustrated. They say, "Doctor, all my tests are normal, but I still feel miserable." And that is exactly what IBS is. One of the best ways to understand IBS is to think of the gut and brain as constantly talking to each other. Your intestine is not just a pipe carrying food. It has its own nervous system. Stress, anxiety, poor sleep, emotional tension, all of these can directly affect bowel movement and gut sensitivity. Have you ever noticed stomach discomfort before an exam, loose stools just before travel, bloating during your stressful weeks? That is the gut-brain connection in action. In IBS, this communication becomes oversensitive. Even normal digestion can feel painful or uncomfortable. Now, let's talk about symptoms people commonly experience. The most common ones are abdominal pain either before or after bowel movement, bloating, excessive gas, constipation, diarrhea, or a mixture of both. Some people wake up feeling normal, but after eating, they suddenly feel that the stomach expands like a balloon. Others plan their entire day around toilet access. Some avoid travel, some avoid social gatherings. Some people stop eating outside completely. And over time, this affects confidence, work productivity, relationships, and mental health too. IBS is not the same for everyone. We usually classify it into three major types. First type is IBS with constipation, IBS-C. These patients struggle with hard stools, incomplete evacuation, straining, and bloating. The next one is IBS with diarrhea, IBS-D. These patients experience loose stools, urgency, frequent bowel movements, and fear of going out. The third type is mixed IBS, IBS-M. This is actually very common. Some days constipation, some days diarrhea, and many patients keep wondering how can both happen in the same person. But yes, that is classic IBS. Now many patients ask, "Doctor, how do you know it is IBS?" There is no single blood test for IBS. Doctors diagnose IBS mainly based on a criteria called Rome-4 criteria, which analyzes your symptom patterns and duration of illness. The doctor does a clinical examination. He rules out other dangerous illnesses by doing various blood tests, endoscopy, colonoscopy, or scans if necessary. Typically, IBS symptoms are chronic, meaning they can continue for months. The pain is usually associated with bowel movement, change in stool frequency, or change in stool appearance or consistency. Sometimes we do tests like blood tests, stool tests, colonoscopy, or scans, especially to rule out conditions like inflammatory bowel disease, infections, celiac disease, or colorectal cancer. If you are someone who suffers from IBS or has a long history of IBS, these are the red flag symptoms that you should not ignore. This is extremely important. Not all bowel symptoms are IBS. Please seek medical evaluation immediately if you have the following symptoms. Number 1, blood in stools, unexplained weight loss, persistent fever, anemia, severe nighttime symptoms, or symptoms beginning after the age 50. These symptoms need proper investigation. Never self-diagnose. One thing I always tell my patients is IBS is not just a stomach problem. It can affect your entire life. Many patients with IBS also experience anxiety, sleep disturbances, fatigue, headache, body pain, acidity, or pelvic discomfort. And unfortunately, many people suffer silently because others cannot see the disease. But invisible illness is still real illness. Now, let's discuss one of the most important areas, diet. Many IBS patients notice symptoms after eating certain foods. Common triggers include onions, garlic, milk products, artificial sweeteners, fried foods, alcohol, and highly processed foods. And this is where the low FODMAP diet comes in. FODMAPs are certain carbohydrates that are difficult for the intestines to absorb. When these foods reach the colon, bacteria ferment them and produce gas. This can cause bloating, cramps, abdominal pain, and altered bowel habits. The low FODMAP diet usually has 3 phases. Phase 1, elimination. High FODMAP foods and foods that trigger the person are typically avoided for around 4 to 6 weeks. Phase 2, reintroduction. Foods are slowly added back one by one. Phase 3, personalization. A long-term sustainable diet is created based on individual tolerance. And this is very important. The goal is not lifelong restriction. The goal is understanding your body better. Now comes the most important question. Can IBS be cured? IBS is a chronic condition, but the good news is it can be controlled very effectively. Treatment usually involves a combination of dietary modification, especially identifying trigger foods, stress management because stress directly affects the gut, exercise, regular activity improves bowel movement and digestion, good sleep. Poor sleep can worsen gut sensitivity, medications depending on whether the patient has constipation, diarrhea, or abdominal cramps. Medications are given to control their symptoms. Sometimes we also use probiotics, peppermint oil, psychological therapies, or gut-directed cognitive behavioral therapies. And honestly, one of the biggest treatment is reassurance. When patients understand that IBS is common and manageable, their anxiety reduces significantly and symptoms often improve too. If you can remember only one thing from today's video, remember this: your symptoms are real. Just because reports are normal does not mean you are imagining it. IBS is common, it is manageable, and with the right diagnosis, dietary guidance, lifestyle correction, and medical support, most patients can regain control over their lives. If you found this video helpful, share it with someone who constantly complains of gas trouble or irregular bowel habits. Leave your questions in the comments and follow for more for evidence-based, practical colorectal and gut health education. I am Dr. Prasanth Nagarajan, and I will see you in the next video.